Hey guys, this is Dr. Mobeen. We're talking about the central nervous system. This is cerebellum. This is review of the cerebellum. We've done the detailed lecture before. Let's very quickly review it. So cerebellar embryology. Rhombencephalon, the third vesicles in the neural tube, gives rise to metencephalon and myelencephalon. Metencephalon in turn give rise to pons, upper part of the fourth ventricle and the cerebellum. So cerebellum originates from the rhombencephalon and more specifically metencephalon part of the rhombencephalon. Then is the cerebellar functional units. The cerebellar functional units are vermis on the central part of the cerebellum. The deeper nucleus of the vermis is called the fastigial nucleus. It's actually a group of nuclei which are collectively called fastigial nucleus. Then para-vermis or paramedian part of the cerebellum, which are the interposed nucleus, nuclei two groups, Emboliform and Globose, together called interposed nuclei. These two things, the vermis and the para-vermis, together make the execution unit of the cerebellum. They help the motor cortex do execution of the activities. Then is the lateral part of the hemisphere, that is the planar part. The deeper nucleus in there is the dentate nucleus. Please remember this, dentate nucleus is responsible for planning and not for the motor execution. Fastigious and the emboliform and globose, the interposed nucleus, they are responsible for execution. Then is the flocculonodular lobe. Flocculonodular lobe is responsible for balance and for the smooth eye movements. The saccade eye movement or saccadic eye movements from horizontal is the vermis and vertical saccadic eye movement is the para-vermis. So vermis is horizontal, para-vermis is vertical, and flocculonodular is the smooth pursuit. After that, we talked about histology. Histology, the cerebellum has three parts, just like cerebral hemisphere: outer cortex, then the white matter, and then the deeper nuclei. Cortex is divided into three layers. From inside outwards, there is granular layers containing granular cells, then Purkinje layer containing the Purkinje cell, and the importance of the Purkinje layer is this is the second most common area that gets damaged by the ischemia or higher temperatures. The first most common area that gets damaged by the ischemia is the pyramidal cells in the hypothalamus. And then is the outer layer or the molecular layer that contains the stellate cells, basket cells, and Golgi cells. Now, important thing here to realize is all cells are inhibitory. That means they also have a neurotransmitter, they use GABA, except the granular cells. Granular cells are excitatory and they use glutamate. So that is the histology. Then we came to the functional unit. The functional unit is very simple. I relate it to the renal system. A kidney is millions of nephrons put together, right? Similarly, a cerebellum of millions of Purkinje cell units put together. So what are those units? If you see here, there are fibers coming from outside. There are two types of fibers, climbing fibers and mossy fibers. Climbing fibers are all fibers that come from inferior olivary nucleus. They come through the middle cerebellar peduncle and inside. Climbing fibers bring very strong impulses. They connect with the Purkinje fibers. They make smaller number of connections there, but every impulse, every signal that comes is then followed by a secondary progressively diminishing oscillating signal. So that is the climbing fibers. Mossy fibers, on the other hand, bring in weaker signals. They are all other afferents coming to cerebellum from everything, from red nucleus or from olive or from reticular formation or from the spinal cord or whatever. All incoming fibers other than the fibers from olivary nucleus are the mossy fibers. Mossy fibers are 1 micrometer in diameter, very slowly traveling fibers. They are actually the ones that are responsible for dampening effect. What happens is, if you see here, this is a granular cell, this is a Purkinje cell, these are stellate cells. A granular cell, when it is excited, the fibers go up in the molecular layer. Here in the molecular layer, the fibers divided into two branches. These branches traverse the molecular layer and they synapse on the Purkinje fibers. Normally 80,000 to 200,000 molecular granular cell fibers can be synapsing on one Purkinje fiber. Then inside the molecular fiber, there are stellate fibers which are on the right angle to the molecular granule cell fibers. So, if the granular cell fibers are going this way, then the stellate fibers go this way. They also make connections here, and what they do is they would create inhibition surrounding the Purkinje fiber that is excited. So, if this Purkinje fiber, let us say this is a Purkinje fiber that is excited, then the surrounding fibers are inhibited by the stellate fibers. So, when the surrounding fibers are inhibited and this fiber is excited, this creates sharpening of the activity. So, the function of the stellate and the Golgi and the basket fibers is to create sharpening. Now, the other function of this functional unit is create dampening. What that means is every fiber that is coming in gives a branch to the deeper nucleus. Deeper nucleus becomes excited and does its function. Meanwhile, the nerve impulse travels up to the molecular layer. Over there it comes back through the Purkinje fibers, and when it comes back it would inhibit the deeper nucleus. So, an excitation occurs when the impulse comes in, then the impulse goes up to the molecular layer, and when it turns back to the deeper nucleus it causes inhibition. That is called dampening. So, this is the dampening and sharpening circuit that is in front of you. Now put millions of such circuits inside the cerebellum and you got cerebellum.
Guys, thank you very much for watching. Make sure that you like, subscribe and share this video. Like it if you like it. If you don't like it, then don't like it. And then subscribe if you want more videos. We upload videos regularly. So if you subscribe to the channel, you can get a notification and the video will appear in your inbox. And if you hit the bell button as well, then you can get the notifications for this as well.